Well, I wondered because I read that the ratio of males to females in one paper that I read, I can send you the references if you like, is 3.25 to 1, and males tend to have higher levels of ACE2. Also,
Yeah.
Southeast Asians as well, who are more susceptible. And I wonder whether there should be sort of public health warnings to specific populations based on their genetic profile.
Yes, we know that men are much more susceptible than women, but we've known for a long time, actually, that women, particularly as they get older, make stronger immune responses than men do. And one of the problems is for women is that they get a lot more autoimmune disease than men do because of that. So it is an issue, and it's certainly the case that if you're female, you're much more likely to come out of this alive if you have to go to hospital. But, that's the fact of the matter, and there are various speculations about why that is, and including a more powerful immune response in women.
Because sometimes, I guess there are two parts of it in terms of infecting people greater with immunodeficiency, but also if you have some of what causes the damage is sort of a misdirected immune response, an overactive immune response from when you contract the virus.
Yes, what we think might be happening here is that in people who don't have particularly good immunity, adapt what we call specific immunity, that is older people, particularly, what we think is the specific immune response is not clearing the virus. The virus persists. And as a result, what we call the innate immune response, which produces a lot of toxic molecules, normally switches on early and can help to hold a pathogen in check until the specific immune response switches on. And we've seen this also with very severe flu, that we think that the innate immune response is trying to compensate for the lack of the adaptive immune response that's producing all this toxic stuff. And it's that's contributing to people dying. And there's been trials done of a treatment, which is an approved human treatment, which is a monoclonal antibody to the cytokine interleukin-6, that have suggested, but rather anecdotal evidence so far, that treating with monoclonal antibodies to interleukin-6 can bring people who are very severely ill back out of that stage. Now, there are proper clinical trials going on at the moment. So we should get the answer to that within a few months, I think. There's also other molecules in that category we could think of. One is interleukin-1, the other one is anti-GM CSF, which was developed at the Hall Institute in Australia. They're all going into trials of various sorts, I think. I know the anti-GM CSF is in trial. I'm not sure about anti-interleukin-1. But these are all drugs which are approved for human use for something else. So once something's approved for use for something else, you can quickly ask for a compassionate use and use it in say, very sick people with COVID-19. So there's no barrier to using these things. We just need to know that they work.
Yes. Well, I know it informed what we understood about Spanish influenza, informed the H1N1 swine flu, where vaccines they would have been directed towards older people, but they actually realised, I remember reading your work about this, that they realised that older people had been exposed to at least some variant of Spanish influenza, and therefore they were protected. And so the vaccine for H1N1 went to younger people and probably saved lives.
Well, there was no vaccine back in 1918-19. We didn't even isolate the virus until 1933.
No.
In 2009,
yes, that's what I was talking about.
In 2009, when it came back, the reason it looked relatively mild is because a lot of people who were alive in 1977 had probably been infected with a similar virus and still were immune, which shows you how long immunity to flu can last for a specific virus. So yes, we didn't see a lot of deaths in the older group, which is why death rates were down. We did see some of what we saw in 1918. We saw fit young adults dying or in ICU units, particularly fit, heavily pregnant women. And some of them died. About half of them were saved by heart-lung machines. And of course, that's a very limited resource. We don't have many of those. The best we can hope with COVID-19 is to get onto ventilation at the most. But it's certainly the case that it was much less severe in 2009, probably because older people were partly immune or had relics of immunity.